Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram. Welcome to our corporate health series, where we aim to bring you awareness on health and well-being so that you can enjoy a productive and successful journey ahead. Health is not just absence of disease. It is more than being free from illness. A state of true health and well-being is an active process of becoming aware of and making choices towards a healthy and fulfilling life by following a healthy lifestyle. And one of the most important and neglected aspects of a healthy lifestyle is sleep. Sleep is a normal body process that allows our body and brain to rest. At first glance, it's a very deceptively simple process. For most people, you may think that it's just a matter of getting comfortable, closing your eyes, and just drifting off into slumber. But this is sadly becoming a rarity for most people. But at the same time, poor sleep cannot be ignored. If you're not getting enough sleep or your sleep quality isn't good, it is going to have a tremendous impact on your health. Your body and brain cannot recuperate, they cannot work at their optimum capacity, and you will not be able to have a good quality of life, a good productivity, or feel healthy even when you don't have a good night's sleep. From a time when people used to be ridiculed or criticized for sleeping more or waking up late or napping easily at all times of the day anywhere, today we have actually come a full circle where we now know that sleep and rest are vital. It's as important as diet and exercise. But unfortunately, life today has also come a full circle. It does not allow us to attain this state of sleep. For many of us, daily life is very stressful, full of work, target, deadlines, technology, machines, travel, deadlines, late nights, and social life, domestic chores. And the first casualty is usually sleep. I think this is something that we all need to know and address. So today we have curated this session for you, where we uncover the secrets of sleep and tell you how to obtain optimal rest and sleep. To guide us on this, we have with us Dr. Prabhash Prabhakaran, who will be our doctor today, who's going to talk to us and guide us on this important topic. Thank you so much for joining us today, Dr. Prabhash Prabhakaran. I'm delighted to welcome you to our corporate health series. Dr. Prabhash is Senior Consultant, Neurology at the Apollo Specialty Hospitals, Banagaram, Chennai. And he's also founder, trustee, and CEO of the Sparsham Foundation, Chennai, and the Creon Clinic, Porur. Dr. Prabhash completed his MBBS from the Annamalai University, Chidambaram, and also his MD in General Medicine from the same institution, and then went on to do his DM in Neurology from the Sri Ramachandra University, Chennai. And his areas of expertise in neurology include vestibular and balance medicine, a special interest in sleep health, stroke, restorative neuroscience, and several other neurological interventions, especially for headaches and complex movement disorders as well. He's also an avid sports person, and his passion is developing apps related to neurology. That's very interesting, Doctor. So thank you so much again for joining us today. So let's begin by asking you, why is sleep so important for overall health?
To know about the importance of sleep, we should know the functions of sleep. Basically, though the brain constitutes only 2% of the total weight of the body, it uses almost 20% of the oxygen that the body has. So by using these things, by using so much oxygen, it creates a lot of waste products. So the waste product clearance is the first function of sleep. So basically, if you don't get a good sleep, the waste products will get accumulated and cause problems. Number two, the energy conservation. Though during sleep, we say only 50% of energy reduction is there, but then it's not by that. By allocating different organs, correct energy expenditure, the body saves a lot of energy through sleep. So these are the two major things. And then comes the memory. Memory is a vital function. We sleep not only to remember, but also to forget. So there are a lot of things that the body might know this is unwarranted or needed, and they try to eliminate those memory things from our mind. And then comes mood. Mood is an important function of sleep. Mood stability. If you don't manage that, where you land up with psychological or psychiatric illnesses. These are the major functions that which make sure that, and then there are a lot of non-communicable diseases, which non-communicable diseases can be caused by bad sleep, or there are a lot of non-communicable diseases which can affect the normal sleep matter. So this is why sleep is very important.
So what are the key factors that actually contribute to the best type or the best duration of sleep?
One of which know the sleep should coordinate with that person's chronotype. That means there are certain people who will go to sleep late and wake up late. There are certain people who can sleep early and then wake up early. So we should make sure that both the sleep pattern and it corresponds to the correct timing. For example, most of the people, the temperature goes down in the body by around 10 to 11. And this is why certain people cannot go to sleep before 10 and they cannot stay awake after 11. One of the reasons, this is one example which I said. And morning hours between 5 and 6, the temperature peaks. So this has to be aligned with the circadian rhythm. So I would say that we should know the body type, and then it should align with the circadian rhythm of a person, because many hormones are secreted according to the correct circadian rhythm. So this is number one. And a comfortable temperature is pretty important. I would say mid 60 degree Fahrenheit will be a good temperature to, and we usually say that lights are important during sleep. It's actually not. A dark area is better to sleep, and definitely yes, alcohol. People believe that a short alcohol drink might help, but it actually harms in the long run. And also, we should a warm water bath around 30 minutes to 35 minutes before sleep is known to promote sleep. A good exercise, I would say maybe 150 minutes per week of exercise will definitely push towards a good sleep. And we believe that naps are good, but actually nap is not sleep. It cannot be a substitute for a good sleep. And more the hours that you use for napping will actually inhibit the sleep. And snoring, people think that snoring is good, but it's actually not right. So there are certain snoring is not. I would not say snoring is always harmful, but there are the troublesome snoring which needs addressing.
Exactly. You were mentioning about how persistent lack of proper sleep can affect psychologically. So let's talk a little more about what effect does sleep play on mental health, particularly mood changes, anxiety, depression, and also is there any link with chronic sleep deprivation and dementia? So what are the different mental health conditions that can be precipitated by an improper sleep?
So when we talk about the sleep and mental issues, we should know that it's not only about the sleep quantity, it's also about the sleep quality. We usually tend to give more importance to the hours of sleep. Yes, it is important, but also the quality of sleep. By quality of sleep, we mean efficiency of the sleep. Also, when you get up in the morning, are you satisfied with the previous night's sleep or not? Basically. So, as we discussed about the functions of the sleep, one of the most important functions was mood stability. So this sleep, there are basically two states. One is sleep with rapid eye movements. The other is sleep without rapid eye movements. So there are a lot of switches which alternates between awake, non-rapid, and rapid eye movement sleep. So these switches are not technical switches. These are chemicals. There are a lot of chemicals which react, maybe thousands of chemicals, which like an orchestra, flowing orchestra, it functions so that the sleep is very melodious. So what psychological or psychiatrical are mostly due to chemical changes. So basically, these are the same chemicals which gets interacted in the anxiety, the mood disorders, depression, all this. So this is why they both are connected. So bad sleep will definitely have an effect on the psychiatric or psychological illness. Other way around though, where psychiatric or psychological illness have an effect on the sleep.
Right. So now that we are talking to a corporate audience, one thing that, as I also mentioned at the beginning, people often equate, like I slept only for 2 hours and I had to finish something and like staying late and studying or staying late and completing work. And of course, we also have this whole work sector, which has the night shifts. So today, a lot of the workforce is affected and there are a lot of risk factors for poor sleep. So people sometimes work late on their systems and we say that we should not use blue light and machines before we sleep, but that's exactly what happens most of the time. So what exactly would you advise these people? Because it's not always possible to change that totally because they're not, circumstances prevent them from being able to sleep well. So what would you suggest?
So number one, it's a myth that. So I can have the question again, ma'am.
No, what I'm saying is that a lot of people now, because we are doing a corporate health series here, so we are addressing an audience of people who are working. And today our work culture is that either you have night shifts or there's a lot of travel disruptions. At the same time, there's also this tendency that, like I stayed up all night, I pulled an all-nighter and finished this work. Or even when somebody is studying, they say that, I stayed up the whole night and studied, I had tons of coffee, that sort of thing. It's considered sometimes like a virtue. It's something that people think it's very good that somebody has kept up the deadline, stayed up, not slept off. So that is going to definitely impact sleep health. So I just wondered what advice you would give for employees and even the employers on this.
Two important things. One, it is a myth that people believe that if I do it consistently, body will adjust. It's a myth. So it will cause long-term damage. Chronic the sleep disturbances will affect body as a whole. An important thing is called sleep debt. Sleep debt means how long you stay awake, you accumulate a debt so that you can go back and sleep. You actually have to complete the debt the next day. But as you accumulate the sleep debt, it will cause problems. For example, hormonal changes and a lot of the circadian rhythm will make sure that the body gets enough hormones on time. So it can lead to multiple non-communicable diseases like stroke. It is shown that 71% of people with stroke has OSA. That is one type of, I'm taking OSA as a prototype to explain the causes which can explain the problems which can be linked to a chronic sleep disorder. So stroke, 71% of people with stroke has OSA. If you take diabetes, there is 5-fold increase in people who has OSA and in diabetes. If you take hypertension, almost 50% of people with OSA has hypertension, and the percentage increases to 83%. For the people who would not respond to the hypertensive medication, the percentage is almost 83%. When you take up pulmonary hypertension, the percentage is around 70% of OSA, and pulmonary hypertension is 70%. And if you take atrial fibrillation and OSA, the percentage is around 60%. So there are a lot of non-communicable diseases which the person will land up due to chronic sleep disorders. I took OSA as a prototype.
I think you have to explain to our audience what OSA is. So this is something which is fairly common that we see. But please explain obstructive sleep apnea to our audience.
This is one of the sleep disorders, obstructive sleep apnea. I'll make it very simple. So normally when we sleep around 9 hours, 8 to 9 hours. That's the usual sleep time. Though we say that we wake up every 90 minutes, usually for a couple of seconds. That's the usual pattern. But in people with obstructive sleep apnea, when these people with obstructive sleep apnea usually are obese. I will not say that everyone with OSA should be obese. Usually are obese, and their neck circumference will be on the higher side. So basically, the airway pathways towards the lung are little compressed. So when they sleep, what happens is when they sleep and they go into the sleep, they will slowly slip into the sleep. The air pathways slowly collapse. And slowly collapse in a way that no air even enters into the lungs or no air goes out. No air goes out. So the the functions of the respiratory thing is to get oxygen to the body and remove carbon dioxide from the body. So basically, oxygen is reduced, oxygen intake is reduced, and carbon dioxide slowly spikes in the body. So the brain's tongue has a sensor which picks up the increase in the carbon dioxide. So immediately the brain senses and makes us awake. So this happens 5 to 10 minutes. Just imagine a person was to sleep for 8 to 9 hours, is woken up every 5 to 10 minutes. So this happens the whole night. So basically, they do not get a good sleep, and their sleep is fully fragmented. And over the years, it will lead to a lot of medical issues. This the percentages that I explained earlier is a proof that it's really a troublesome disease. The thing is, it is treatable. It can be addressed completely by certain medical devices which we apply on the face. There are certain medications which might help, and there are good surgeries which in properly indicated patients which will work wonders. I have had patients who had multiple health issues with OSA. For example, who was into a lot of infertility treatment, was not getting, and then following a treatment with OSA, yes, kids, I'm telling this on exam. So it's a difficult disease, but it is addressable if properly identified and correct course of action is taken care of.
So may I ask you here, how do you diagnose this? So when should somebody come and see the doctor?
So in obstructive sleep apnea, people usually the complaint is they are not satisfied with the previous night's sleep. When they wake up in the morning, first is history, then only comes the test. So basically, when they wake up, they are not satisfied. And second, the mood changes will be there. And usually they complain of heaviness of head or headache on waking up in the morning. It's not that everything should be there, but these are all pointers towards the disease. And the most important is snoring, heavy snoring, which breaks in between. And most of the people with OSA are on the obese side, and their neck circumference is little on the higher side. These are the symptoms that we will be looking into, and they usually have hypertension, which usually doesn't respond to a good number of medications, and other diseases. A host of diseases can be accompanied, and this is diagnosed by a simple test called polysomnography. That is, you examine the sleep. So it is usually the gold standard to diagnose is a level 1 polysomnography, where we admit the patient in a hospital overnight and monitor the sleep with varied sleep parameters will be seen. So there will be people who will be observing in the next room, and we will be able to diagnose it correctly. There are other ways also, like home monitoring of home sleep, and there are multiple levels. So it is diagnosed by history and polysomnography.
I think here it is pertinent to mention that I think recently we have also, in our Pro Health check programs, I think a lot of emphasis has been placed on detection of sleep disorders and particularly obstructive sleep apnea. So I think there's also a kind of a questionnaire that is being administered to all patients undergoing a health check. So this is yet another reason why I feel that people must undergo a comprehensive screening program so that, they can get diagnosed. I mean, nobody might think that, it was important to look at a sleep disorder, but then we have just heard from the doctor that, it leads to so many health complications and it is treatable. So I think it's important to recognize these symptoms first of all and then seek medical help. Moving on, I just wanted to also know whether I'm sure sleep disorders are numerous. What are some of the other types of sleep disorders that people might have?
Before talking about the uncommon one, the commonest one is actually insomnia. Though there are 3 types of insomnia, where first is they have difficulty in getting into the sleep. And the second type is difficulty in sustaining sleep in the morning hours. They wake up early and they don't get sleep after that. And the third type is frequent awakenings. So the treatment modalities are different for all of these 3. It's important to diagnose that. And the next uncommon disorders, first I would suggest it's a REM sleep behavioral disorder, RBD. So we spoke about 3 states of sleep: awake, sleep with REM, the eye movements, and sleep with non-rapid eye movements. There are 3 names, and this moves in each circle, and then one state, next, and next. Though we talk about this, it's actually not separate states. So when one state superimposes on the other, then the disease state comes into play. Or if the switching is not very melodious, the things will happen. For example, RBD. So RBD normally during a REM movement sleep, we see a lot of dreams. So the brain activity monitored through EEG is equivalent to an awake. Though we are sleeping, the brain activity is equivalent to an awake period. So to avoid problems, the body is cut off. From the brainstem below, nothing moves. The brain is in a high state of activity, but body isn't. That's the usual way it is set up. But if the awake period will superimpose on the rapid eye movement sleep, what ensuing thing is called RBD, where we enact the dreams, because that paralysis is not happening, and whatever dream that we see, we just enact. They might shout, they might just feeling the arms or feeling the legs, causing injury to the bed partner, and they might speak aloud. So this is one. The other one is RLS and PLMS. So restless leg syndrome and periodic limb movements in sleep. These are all a spectrum of disorder. The lower end is RLS, and the higher end is periodic limb movements, where the person keeps moving the limbs. They have an urge to move the limbs. This is due to their form that is due to reduced dopamine in the brain, and we can easily treat it by giving medications for that. And the other one is called narcolepsy. Narcolepsy is where the other way around, the patient is awake and they superimposed on an awake person. So basically, when the person is while speaking, they suddenly have an attack of sleep. They might fall down. It's called cataplexy, because they lose the tone and they might fall down, and they have hallucinations. So it's actually treatable. So you need to diagnose this to pick up.
So I think the key thing there is actually to pick up these symptoms and take medical help. The other important topic regarding sleep is the sleep medications. So there is always this propensity maybe of popping a pill to sleep. And here we know that in India it is quite unregulated, so you can go to a pharmacy and get a medication. There are a variety of medications. Some of them cause dependence, and it's not. And then there is, of course, the danger of overdosing, and then combining it with alcohol. So these are all some of the abuse potentials in treating sleep. So would you like to give us an overview about that as well before we conclude?
The points. One, as we discussed earlier, in insomnia, there are 3 types. One, not getting sleep in the early part of the night. And second is frequent awakenings. And third is not getting sleep in the late part of the night. So with this also, it's very clear that there is no one medicine which is going to suit all. You need to find the correct medicine for the correct disease and then treat. So number one. And number two, there are medication. If you take obstructive sleep apnea, you cannot use certain type of medication. It's actually harmful. So again, insisting that it's important to investigate before starting on medications. Having said that, medications are not the correct way of treating the sleep issues. The number one is actually correcting this sleep hygiene. The correct sleep hygiene is very important. So sleep hygiene means there are a set of rules that you should follow to have a good night's sleep. For example, you should go to bed always on a correct time. Always try to maintain the correct time that you go to bed, and waking up should be on a correct time. Consistency is very important thing over here. And avoiding screens 2 hours before sleep, because the brain senses the blue light from the screens as sunlight, and it will delay the release of certain hormones which will promote sleep. So number two. Number three, exercises is very, very important. As we discussed earlier, 115 minutes of exercise a week is good, but it should be completed before 2 hours before sleep. So any increased activity during or 2 hours before sleep is actually harmful. You can read books, but not through screens. And then food, maybe at least around 2 hours before sleep, you should have completed your dinner. And this, as we discussed earlier, about the light, about the temperature, these are pointers towards a good sleep hygiene. And we counsel the patients who has come with sleep issues to maintain these. And if they are not able to maintain that, we refer to CBT, that is cognitive behavioral therapy, which is an intensive course where we will be able to train the mind to perform in a way which will promote sleep. This is very important, but the only problem is this needs a lot of effort from the person. So that is one downside, but if you do that, it works wonders. And the third one will be medications. So medications, there are multiple types now. There are newer medications available with less side effects. There are certain like melatonin, which is a harmless one. There are multiple medications now, but please avoid taking over-the-counter medications. Evaluate first step, as we discussed, second step, and then come to medications.
Yes, I think that's a very important message, that self-medication is not the answer for any sleep disorder. I think, is there anything else that you would like to tell our audience before we conclude the session?
Okay. For example, I would like to bust certain myths that is very common in our country. As we discussed, you would have noted. Number one, the myth is snoring is harmless. It's a myth. We always believe that when a person sleeps well with a good snoring, he is sleeping deep. It's actually not. You need to evaluate if the snoring is heavy. Number two will be the naps. Naps are good. Naps is always a nap, never a substitute for sleep. A short nap of 20 minutes is okay, but more than that, it will definitely have an impact on the quality of night sleep. And third, women are a 40% higher chance of developing sleep issues. So it's important to have a vision on that side. And there are a lot of if the body, as we discussed earlier, the body will adjust to a chronic sleep disorder. It's a very harmful myth. It can cause the diseases, as we discussed earlier.
So thank you so much, Dr. Prabhash, for this wonderful session. So dear viewers, now you know the secrets of achieving optimal sleep. So blessed indeed are those that have lives where there are no stresses, no dreads, and to whom sleep is something that comes easily and brings nothing but sweet dreams, is what somebody said. But that is not always possible, but we can try to achieve the best sleep and rest for optimal health. And the key message here is to address the symptoms. I think sleep is something which only you can say if there's something wrong with it. I think you need to take medical advice. And this is why we have actually incorporated sleep assessment and recommendations and consultations as part of the Apollo's Pro Health package itself, so that it is not missed when you have your annual screening. So do have that regularly. And you know that we are always available to assist you in managing your sleep-related issues. And you have a helpline displayed there. I think you can just seek our help, and we will be able to book you into Pro Health and also make sure that your sleep is optimized and you can enjoy better health. Thank you. Until we see you next time. Namaste.